Hi guys. Hi guys. Welcome back to another video. Welcome back to another video. Let me open the super chat and hear what you guys are saying. Today I'm going to open up to you guys a little bit more. Hello Margaret Shando. How are you? I hope you're doing great. How are you guys? Is everyone at work or people are not at work at the moment? Hey, Shiku. Hello, Fiona. Fiona Opio, nango nyarumse. I know that you are a Luo because of your name. Opio is. Hey, Margaret Chando, good to see you. I thought to be live again. I'm thinking I might be doing more of these lives instead of sitting down and uh, and actually making like a recording a video and editing and all that. I thought that the live camera is also quite clear, so it's okay for me to also do these lives. So I know that you guys have seen the title. Yeah, I want to tell you guys what it is all about. But first, Afrobeat, non-copyright. Is it non-copyright? Let's wait a little bit for other people to come on. Good to see you. We are waiting for more people to come on so that we can talk. And meanwhile, please ask me questions. Ask me as much questions as you can. Question and answers, but then I want to talk to you guys. I don't know if maybe people will catch us later. Maybe some people are at work and they are not able to catch the live. So, because I can see 10, there was a time I hit 100 people was on the live. But since less people are, yeah, Jenny, hello, hello, yeah. Anyway, somebody opened the door and I thought they wanted something. So I just want to I want to tell you guys about the diagnosis from the doctor. Yes, Fiona, I am still in Dubai. So what I wanted to talk to you guys about was a bit, you guys, I know that there are people who are watching who probably clicked this video so fast and maybe they are thinking, oh my God, because you know, I was reading, there was somebody who actually on my comment section, people are crazy, I told you guys on social media. Somebody, I don't know, I was speaking about something in one of my videos and then somebody was saying that I am here on social media, I am waiting, I can't wait for your downfall. So yeah, at work but sneaking in to chat a bit. Margaret Chando, yeah, yeah. I'm really waiting for your downfall. So there are actually people who are actually waiting for my downfall. So maybe some of those people might have come to actually watch this video to see. Let's see Empress's downfall. Oh my God, she has. Guys, so the thing is about the core topic of the video is that I was diagnosed sometime this, is it early this year? Yeah, I was diagnosed with prolactinoma, and that is a form of brain tumor. And basically what happened was that I went to the doctor for some random checkup for my fertility health checkup, because I've never even gone to, I never went to gynecologist. Like, I felt like it was not like, in my mind I always felt like I'm fine, everything is perfect with my body. And apart from the yearly medical test that we do, as obviously we used to do, as not yearly, in after every 3 years or 2 years, we used to do random, like a mandatory blood test for the flight attendants to keep their licenses. So I went in between, I went to have, because I've never gone to check my levels. I've been all my levels, especially to the gynecologist, because of my fertility health. So I went, and the doctor, some of my levels didn't come out normal. So I'll just want to read for you guys what the tumor is all about online. So prolactinoma, it's not cancerous, guys. It's not cancerous. It's non-cancerous. So it's not something that is like, oh my god, she has brain tumors. She has brain tumor. No, it's nothing to do with cancerous or anything like that. So prolactinoma, I'm reading it for you guys. So it is a non-cancerous tumor of the pituitary gland. This tumor causes the pituitary to make too much of hormones called prolactin. The major effect of prolactinoma is decreased level of or some sex hormones, estrogen in women and testosterone in men, and that just continues. They just have a lot of myoclinic symptoms, tells you all that. So me, I had no idea that I had prolactinoma, apart from my eyesight had really gone horrible, and I've never even had problems with my lady days, monthly periods. They've always been fine. They come perfectly on time, based on my, so on my calendar. So the tumor is right here in the back of my, everybody I think have the, is it called, is it the the gland, the, what is it called, it is pituitary gland. Every single person have it here, but mine have tumor in it. So mine messes up the hormones in my body. So because it has a tumor, that tumor is not supposed to be there. So in my pituitary gland. So then I was diagnosed with it, and it also not good for you, especially if you are, because I was always experiencing pain in my breasts, a lot of pain. So like, even I can never, like, now they are, I even went to do mammogram to just make sure that things are fine. So I was diagnosed with that, and that is not good. That prolactinoma is actually not good for your fertility health. It might, because the hormones that, one of the hormones, the prolactin hormone, is a hormone that a woman produces when they are lactating, as in when are they just had a baby, and or pregnant, I don't know, and they are lactating. You know, the breast milk is for the baby. Their body is preparing to give baby milk. So that is that hormone. It's supposed to be there, but it's not supposed to be produced in high levels when you are not pregnant, or when you are not breastfeeding. So to me, actually, it is producing higher level than normal, making my fertility body confused, thinking that I am actually a mother, or I am breastfeeding, or I just got pregnant or whatnot. But that is not the case, obviously. So the hormone is going all over the place. So apart from that, that hormone, there was actually other hormones that were a bit off. And for me, it's like I found a doctor who was really good, because I did the test with another doctor. But you know, in this country, most doctors are very, like, they are very quick to dismiss, like they are not very thorough. Then I found a different doctor who was actually checking all these levels to find out if all my levels are fine. So in case when you want to start having, you know, maybe you want to check your fertility health. Some women don't even know that they're prolactin, that they have prolactinoma, because the doctors don't, I think the test itself is a bit expensive here in the Emirates. But it was covered by my previous insurance in my previous job. So I had all my blood run test, LH hormone, there is luteinizing hormone, there is FHS, is the one that shows your fertility doctor exactly how much eggs you have, like do you still have viable eggs in your body that you can be able to conceive. And luteinizing hormones, I don't know what is that. I don't know, it's just a lot of things in the fertility world. If you are going through fertility, you know, you might as well remember to ask your doctor to check for your prolactin levels, because your prolactin levels, if they are high, obviously it's not going to be easy for you to become pregnant, because your body, your hormones is telling your body that you're already pregnant, or you just had a baby, you know, and you're breastfeeding, when that is not the case. So if that hormone is actually produced in higher than normal, then that's not okay for you to, you can't even have a baby with that. And also your although infertility, I'll just tell you what else it says here. Although prolactinoma isn't life-threatening, it can cause vision difficulties. Yes, my vision is not good. It's not good. So it can cause vision difficulty. That is one of the, which I didn't know. For me, I just thought that it was normal, that my vision was just getting worse and worse, that I even had to get myself glasses. I couldn't see, and you know, even my license was at some point suspended, because my eyesight was very bad. So I had to be suspended even from flying until I got a new license, which indicates that I need to wear glasses at work. And so I didn't even know that those are one of the signs that I had the tumor. Although prolactinoma isn't life-threatening, it can cause vision difficulty, infertility, and other problems. Prolactinoma is the most common type of hormone-producing tumor that can develop in your pituitary gland. So everybody have pituitary gland. It is a gland over here, but I say to you guys that mine has a tumor in it. And so there is a way that they usually lower the tumor, as in lower the level, as in lower it down. Either they do surgery to remove it, but I feel like surgery was a bit like opening my head and removing it. I feel like that's a bit of it's just a bit extreme. So other thing that they usually do is they give you medicine. So this is a medicine that I have been taking. It's called Dostinex. It's called Dostinex. I don't know if you guys can see. So basically it's just like really like tiny pills in this tiny bottle, and I usually take, like, I'm gonna be on this for like as long as, you know, as long as I still want to be, you know, to become a mother. I have to be on this so that my hormone levels can be, my prolactin levels can go down. So I usually take this one pill after every 2 weeks. I take one pill after every 2 weeks. Yeah, so this one was prescribed, and I've been taking it since since February. I've been taking these pills along with the vitamin D, whatever, 5,000 milligram, 50,000 milligram twice a week. No, one times every 2 weeks. And then I have other medication that I can't be bothered to show you guys. So anyway, yes, you guys, so that is what is happening, and that is what this video is about. So if you guys want to ask any other questions, so Sorry to disappoint you. It is a tumor that can be what is it called? It's a tumor that can be controlled via medication. Yeah. Okay. Hello, fam. That sounds hopeful. Thank God you're okay. Thank God. Wishing you increased health. Thank you guys. Anyway, if you guys were not busy, maybe some of you are not at work and you want to ask any more questions, you can ask them. So I'm just here to tell you guys that I am pretty much okay. What I feel, I don't feel okay. My eyesight is not as bad as it was since I started taking this medication, but I have not gone back to the doctor to check my levels. I checked my levels again in March, and they had lowered a little bit. But since I'm gonna be always on this drug, hopefully by the time I will need to, everything is gonna be fine taking this drug. So I need to go back to the doctor to check my hormones because but now I can't because of the whatever is happening in the world now. Hospitals are not taking it in any patients unless it's something emergency. So that is the reason why I cannot go. So anyway, guys, it was just a small live. And again, I want to thank the person who contributed yesterday. I have noticed that it is actually possible for viewers to contribute, as in to donate via the live, in the YouTube live. And I didn't know. Every time I was doing live, I saw people were like contributing. Last week when I did live, someone contributed, and again the last time I did live again, someone contributed, and I really had no idea what happens with these contributions. But I've just noticed that actually it is possible for viewers to contribute towards live. And for you guys who had contributed, I just really had no idea, but thank you guys. You didn't really have to. You didn't have to, but you chose to anyway. So I appreciate it. Please don't feel like I did not acknowledge that you did. I just had to go and find out what everything was, what the dollar sign was all about, because I could see the donation pop up on my video when I was doing live, and I didn't really know what was that all about. But now I have noticed that it actually is possible, and there's a lot of YouTubers who get a lot of donations from people like from the live chat, and I didn't even know that something like that is possible. So thank you guys for this. And I think this video, it was just a short video talking about this, and I hope you guys have a lovely day. What made you go to the doctor for the diagnosis, Fiona Apio? It's because I wanted to check my fertility health. And when you are going, if you go to check your fertility health, and you go to a good doctor will have to make blood run also to check your prolactin levels, because that is one of the mandatory fertility checks that you need to have. So yeah, this doctor, because there's a lot of women who don't do them. Sometimes they try to conceive and they are not conceiving, or by the time they are ready to try for a baby, they don't conceive because they don't know anything called prolactinoma. So some of them have prolactinoma and they have no idea. So this video is sort of just awareness for the women who haven't done their fertility checks. If you want to do it, make sure you also do your prolactin levels. They need to be checked as well, because even me, I had no idea. But now that all of a sudden, I thought everything was perfect, but all of a sudden I felt they told me that, oh, you have a tumor. I was like, what tumor? What is that? I freaked out at first, but then the doctor explained to me what it was. But yes, in the fertility world, to have the prolactin level elevated is not good for your fertility health. So it's not good at all. Your body is actually acting as if you are pregnant, or as if you have just given birth to a baby. And for some people, they even produce breast milk, and they are not pregnant, and they are not even they didn't even have a baby. But that is one of the your mammary gland gets messed up and starts getting acting up. So for me, my mammary gland was acting up, but I didn't have milk in coming out. It was just like a bit too swollen and too tender. it made me feel like, oh, something is wrong with my breasts. So I went to the doctor to check if everything is good, and they did mammogram, and they just didn't even have anything in there. That obviously that was one of the signs that I had prolactinoma. So, and I had no idea. So Fiona, that answers your question. Is this tumor linked to thyroid issues too? No, actually, my thyroid glands are fine. The tumor is not, the tumor in its own is not linked to any thyroid issue, but it's linked to fertility. It is linked to fertility, and also it lowers your sex drive. Like, you can't be bothered for, to the libido goes down for men and women equally. So yeah, so unless you get it treated, it's just going to be like, yeah, so that is most probably tells why I've never been bothered. Why I've never been bothered to get laid. Yeah, so yeah, that is one of the reasons that I cannot be bothered. I don't go around trying to find guys to get me laid. So that's why. That explains the reason why. Mind over matters, as that's your question is answered. Shiku, thank God it isn't cancerous. We were worried from the title. Don't worry, you shall be healed in Jesus' name. Yeah, the title, please don't come for me and say that I am clickbaiting or I'm what not. Go and check for something called prolactinoma. Prolactinoma. It is a tumor in your pituitary gland. So some people I know are gonna come to my videos. Oh, you see, she did. No, it is true. It is true that there is a tumor. They usually tumor in a pituitary gland. So it's just not cancerous. Not all tumors are cancerous, and this one is not cancerous. Thank God, it's not. So somebody else is asking a question, Shiku. Yes, thank God. Mind over matter. Hope you get a good husband soon. Mind over matters. That prayer is already answered. I remember when you said you were going to the doctor for testing. Yes, I did, and that are one of the results that came out. Maybe TikTok clock is ticking. I mean, it's nice in a nice way. What is that? Maybe TikTok clock is ticking in a nice way. I'm not sure what you mean. Margaret Shando, thank you for this talk. Impressed. Is there any treatment to reverse this condition or to control the hormone level in the pituitary gland? Yes, the test is you have to take this a medication called gabagoline. So the medication is called gabagoline Dostinex. That is the medication. If you go and check on Google what is the medication for, first of all, find out if your levels are fine. If your levels are fine, you don't need to be worried. But if you're somebody who've been trying to conceive, and yeah, the doctor checked even your prolactin and it's fine, and you're still like unexplained infertility, then like, if you found out that you have a problem in your prolactin, that you have a tumor, you have to be on this medication. I don't know if you guys can read it. So it's called Dostinex. Yeah, so the doctor will put you on this medication, and then after I think you need to be on it for 3 months, and then go for test again. But for me, I've been taking it ever since, because I've not gone to the doctor yet for more testing. And there is I haven't read that there is any side effects. I don't have any side effects, because a lot of people are saying that this medicine have crazy side effects. But I've always been lucky. Most medication don't really give me side effects. Even I took, there's a medicine that I took to clear my acne. That medication, people usually swear that it has the worst side effect. But for me, it didn't give me, it gave me zero side effects. So yeah, thanks. Asking for my daughter. Let me see what you've written. Yes, Dostinex. No, it is 0.5 mg. One tablet is 0.5 mg. So usually the doctor says to take half, But me, I usually take 1 tablet every 2 weeks. Yeah. Sometimes people take 1 tablet every, like whatever is written in the instruction box, that is what you go by. For me, I've been taking 1 tablet every 2 weeks. Yeah, 0.5 mg. But first of all, you go to the doctor and then you check the levels. I don't think this medication you can just be given. I think this medication needs you to have prescription for you to get it. Yeah, because I think it's a controlled drug. So yeah, you guys, that is the end of this video. If you don't have any more questions, let me check out, and I hope to see you guys on my next live. Have a lovely day. Bye bye. Thank you for watching.